In terms of cosmetic and aesthetic surgery, breast reduction actually is as much a functional operation as it is a cosmetic one. A lot of people who come requesting a breast reduction have neck pain, have pain from their bra straps, find they can't exercise because their breasts bounce around too much, or quite simply because they hang so low they get what's known as intertrigone, which is recurrent skin infections just underneath the breast. It's a hugely successful operation, and most patients are delighted with the result. It is also a very cosmetic procedure because at the same time as reducing the breast, one can very much reshape it to give a very nice aesthetic look to a lady's breasts. One should be able to hit approximately the right bra size, but I never guarantee a bra size, because the most important thing is actually that the breasts are proportionate to the rest of the frame, and of course to their age. There's different ways of doing a breast reduction, and people talk about a vertical scar or a wise pattern scar. And to be quite honest, the best technique is the one which your surgeon does well. I offer both techniques. I think the vertical scar is best suited for people who are having an uplift but also a relatively small breast reduction. And I think the wise pattern technique is best suited for those people having a large breast reduction because it gives more flexibility to me as a surgeon to achieve the shape I really want to achieve straight away after the operation. The results of breast reduction, as I've said, are for most people fantastic. They are extremely pleased with it, and the complication rate, certainly in my practice, is extremely low. But people should be aware of nipple or fat and skin necrosis, where areas of the skin or breast can go black and die, and can take a long time to heal. With the exception of nipple necrosis, a little bit of skin necrosis in, I think, many people's practice is quite common. I rarely see it, but when I do see it, it actually, although being a massive inconvenience to a patient because it takes longer to heal, very rarely affects the long-term result. And if it does, it's simply because there is a slightly stretched or broadened scar which is easily revised at a different time anyway, so it doesn't usually have a long-term effect on the aesthetic result. Functionally, the results of a breast reduction are usually fantastic. People who have come in complaining of neck pain and bra pain are delighted that they can buy bras that fit and also buy bras in normal shops rather than having to go to specialist shops and wear bras with enormous support in just so they're comfortable. The fact that they can now buy bras in a normal shop and buy sexy, good fitting, feminine bras is something a lot of women after breast reduction are delighted to be able to do. In addition to that, when they take their bra off in front of their partner, they are usually delighted with the aesthetic result.